Start out with a quick look at SpotOnResponse for clinics. Each of these logos represents a member of CCA-LAC. The yellow list down at the bottom with all those logos are all of the clinics themselves. When we talk about the profile information and the branding, this logo represents the Linus Family Clinic, the Children First Early Head Start in Inglewood, address information, website so that someone can go there. This one happens not to have phone and email, but those that do, it's an active email link so people can go up and say, gee, I want to know more about you and make that connection, as well as looking at the website, got hours, services, and this is whatever information the clinic itself has provided. Let's go take a look at another one of these. There's the school-based teen clinic from the Eisner Pediatric and Family Health Center. There you've got the email address and the phone number so that a patient looking for some services is able to say that this person or this organization handles diabetes and pediatrics, and if I want to make an appointment, I can call directly in there. So an outreach component for the clinics themselves when this is on the website or at the point when it actually becomes distributable out to the population itself. At the same time, there's more information that you don't want the public to see. And if I were to pick any one of these other than Community Clinic Association, I would not be able to see it because I'm not a member of that organization. But for CCA-LAC, we see, first of all, just through SpotOnResponse, I pretend I'm located over here, and I'm in walking distance over here to CCA-LAC's locations. You see the Carlos entered this information a while back, and there are a couple of plan elements and a resource element. Let's go take a look at the plan. And for this, we just have an example of a floor plan. And if I click on it, that's the Northeast Valley Health Corporation that we've just borrowed as an example and are able to use it to illustrate that this information would be available on the mobile app so that if someone needs that specific information, there's a response plan associated with it. This is a medical clinical emergency template, just one that we grabbed as an illustration because that's the province of CCA-LAC in our demonstration here. We're just using some illustrative examples of the way in which these clinic templates that Carlos and his group have prepared are able to be used by the clinics themselves to develop a better emergency planning component. Then if I go over here to the resources one, you've got an example here. This is a resource request form and instructions that is part of CCA-LAC's routine procedures in making that request. And as well, if this were a clinic, I have the capacity to do a couple of things. First of all, I can come in here and when I wish to change my status, it's simply that I click on my little editor pencil up there, and I've got the closed, reopen, and special condition status. I'll select one of these as a special condition here, and we're going to quickly see that down at the bottom here, CCA-LAC is now a special condition, and if I go back onto the map, we're going to find that it is also represented by a color change and location down here and a special condition associated with that. And that's effectively the quick way that any of these groups can interact and expose their status information off to everyone else, other clinics, and through Exchange Corps out to ReadyNet, and it will be offered out to the 911 organizations as well.